the European Hematology Association, we went through a period of, as we entered this COVID crisis, of hoping that we would be able to get to having our meeting. This was a very important meeting for us, after all. This was the 25th EHA meeting that we were hoping to welcome everyone in Frankfurt. So we went through a period of hope that things would settle down, to a clear realization when things really took off in Europe that this meeting could not happen in reality, but very quickly make the decision that it was very important for us to go ahead with the meeting, and are now in very quick time planned a virtual meeting which is going to go ahead in June. There's various ways in which you could do a virtual meeting. We could have done a very pared down meeting and just had the basics on, but we felt it was important for our community to have the whole educational and research component on there. So we are planning a full meeting. The platform will be up and available for a full 4 months, so that delegates who have signed in can watch the meeting as stuff comes online, but we'll be able to go back and look at everything over a full 4-month period. That will include all of the satellite symposium that the sponsors are planning, and that's all going ahead. They will also be on the platform for 4 months, so that unlike the meeting where you may not have been able to go to a session because it's competing with something else, you will be able to look at a later time at those sessions. All of the plenary sessions, all of the abstracts are going to be presented. All of the invited speaker program is going to be included on the program. We're using a quite novel way of putting the platform up. It uses an artificial intelligence type situation, a little bit like if you're going on to Netflix, where the system would be able to adapt and determine what it is that you're most interested in, so that if you let that modality work for you, it will alert you to the things that you may be interested in. But you have, on the other hand, a simple choice of going in and looking at the abstracts that you want. Now, we're aware that when we're having a full meeting being delivered over what would have been a 4-day period, that's going to be very difficult to do. So we're going to lengthen the period in which presentations are going to be highlighted over a 10-day program based upon themes, with the first day being the satellite symposia, the next day being the Young EHA research meeting, and then the meeting unfolding over the next few days based upon themes. There'll be a lymphoid malignancies day, a non-malignant hematology day, a myeloid day, and etc., where we're going to be highlighting things to make it potentially more interactive. We are also aware that, you know, these approaches can work very well, but can seem sterile, and we do believe that interacting is a large part of what people get out of the meeting. So we are working hard to try to make this program be as interactive as we can possibly make it, in terms of having chat facilities, etc. An exciting component we're also having is that for the sponsors, where you're used to being able to go and meet people at the booths and talk about the new drugs which are emerging, we're going to have a virtual exhibition site where all the sponsors will have a site where delegates can go and look at the information from the different sponsors and ask for information about the new drugs and things that are emerging. So overall, we've worked very hard, and I've got to take my hat off to the office, who've done a huge job in terms of getting this all together. We're pre-recording all of the presentations, such that even the ones which will go out live will have been pre-recorded, with an opportunity to then have an interactive component to what's being done. But all of the invited abstracts have already been invited to sign on and film, as I'm doing here now, an approach which then will be used and loaded onto the platform for viewers to look at.